Hey there, parents and caregivers. If you've got a newborn baby at home or you're expecting a newborn baby soon, then this video is for you. Because in today's video, we're going to be talking about the amazing milestones that I want you to keep an eye out for that are going to happen during baby's first 3 months of life. If you're new to the channel, my name is Cherrick Gordon, and I've been a pediatric physical therapist for over 20 years. My goal with this channel is to provide evidence-based techniques that I've used over my entire career, but to break them down in a simple way that you can use them in your home. Let's talk about movement. Under the category of movement, we're going to be breaking it down into two areas. Gross motor movement, which is movement of your big body parts, and fine motor skills, which is movement of the hands. So let's start with the gross motor skills. Early on, you're going to be looking to see if your baby is actually lifting their head up and holding their head up while they're on tummy time. Then you're going to be looking to see, is your baby able to bring their arms forward and prop themselves up on their forearms while they're in tummy time. When it comes to fine motor skills, your baby is born with their hands kind of like this in these tiny little fists. But pretty soon you'll start to notice that if you put your finger in baby's hand, that your baby can grasp it and hold on to your finger. That's the grasping reflex. And pretty soon baby is able to hold on to like a rattle if you put it in baby's hands and actually be able to start moving it. I once saw a baby reach in, at like 2 days old, reach, take their pacifier out, flip it around and put it back in their mouth because I deliberately put it in their mouth upside down. So that was pretty exciting for me to see. So you want to keep an eye out for those fine motor skills as well as the gross motor skills. Up next, let's talk about social and emotional milestones. So at around 2 months of age, your baby will give you their first real smile. I have a picture of my daughter that's smiling like while she was in the hospital a couple of days after she was born. So I guess that varies. But that's what neurologists say. It's the first real smile in response to your smile. This is something that neurologists call serve and return, where you smile and then baby receives your smile and returns the smile, returns with one of their own smiles. I have a great video that I did about cognitive skills, and I'm going to pop the link for that right there so you can check that out if you want to. But you'll start seeing these emotional and social connections right around the 2-month mark, where baby will start to recognize your voice and also be able to calm down when you speak simply because baby is recognizing your voice. Up next, vision milestones. So when your baby is first born, they really cannot see objects that are very far away. They don't have that depth perception as yet. And so they can only see objects that are about 8 to 12 inches away from their face. So kind of like where I am right now is what baby can actually see. So that's just close enough for baby to be able to focus on your face while you're feeding baby. Also, as baby begins to develop, baby will, right around the 1 month mark, be able to start seeing objects that are a little bit further and be able to lock on to those objects. By the time baby's about 2 months of age, you will notice that baby can move their eyes from side to side and track an object. And they can also start to turn their head from side to side and follow an object or follow your face as you're moving your face from side to side. Next, let's talk about communication milestones. Yes, crying is a form of communication. As a matter of fact, it's a very effective and powerful way of communicating. At around the 2-month mark, you'll notice that your baby has different types of cries. There'll be a cry when baby's hungry. There'll be a cry when baby's uncomfortable, baby's wet and needs the diaper change. There'll be a different cry when baby just wants to be picked up and held. And these are all different subtle forms of communication. You'll also start noticing baby cooing and gurgling at around that 2-month mark, which is very exciting to watch. As a bonus, I decided to throw in a couple of things to keep an eye out for, and those are reflexes. Now, reflexes work differently from normal movement. And Reflex, what happens is with a reflex is that the circuit bypasses the cerebral cortex, the front part of baby's brain, goes from the brain stem straight to the muscle. So it happens very quickly and baby doesn't have to think about it. So some of the reflexes to keep an eye out for. One is the grasp reflex. If you take your finger and you put it in baby's hand, baby should be able to grab your finger and hold on to it without thinking about it. That's the grasp reflex. Another reflex is the rooting reflex. The rooting reflex is what baby will use to help baby survive. So it's built in there when it comes to feeding. The rooting reflex means that if mom puts her breast nipple towards the edge of baby's mouth, baby will turn their head to get the nipple in their mouth or the bottle. So if you touch the corner of your baby's mouth, you should see baby turn their head to try to start sucking on your finger. Another reflex to keep an eye on is the startle reflex. The startle reflex is where baby does this and throws their hands backwards, and you want to see that expression where the hands go outwards and then come back in. Now, this startle reflex will begin to calm down by around the 8-week mark, but in the beginning, it's there and it's very powerful. So those are a couple of reflexes to keep an eye on. If you found this information helpful, please consider hitting the like button. Also, you might want to consider subscribing to the channel. I would really appreciate it. And share it with anyone you feel would benefit from this kind of information. I also have a great video about cognitive development, early cognitive development of your baby, and I'm going to pop the link for that right there. All right, I'll talk to you soon. See you in the next video.